Good afternoon, everyone. It is a pleasure to share with you today some insights on measuring impact over the long term. So, what I can promise you is this, that it won't be boring and I will not tarry. I will not be before you long, but we will have a good time, hopefully, talking about measuring impact over the long term. Next slide, please. Our agenda is as simple as it's put before you. We've had the welcome and the introduction, the primary goal we'll share. There'll be some participatory opportunities in here. Then we'll get right into just discussing impact in the long term, measuring impact in the long term, looking at some case studies, and then we'll have a question and discussion, even though the option is to have ask questions when they come top of mind, and we'll continue there. Next slide, please. So this is me again. As mentioned, I come from a long background in fundraising, and I'm happy to share today. Next slide, please. So the primary goal is to share insights related to fundraising strategies with you all to help you better understand how to successfully fundraise for projects and programs where impact is typically measured over the long haul. Now, let me say this up front. What I am going to share today is not likely to be earth-shattering, but it is real, and it will get us to a point where we come to understanding that measuring impact has to be reimagined and established in a way that builds trust, considers assets and resources, and leverages those assets to move the mission forward. But we will delve into that a little bit later. So, next slide, please. You may be wondering what I have to share today. What does that have to do with journalism? Well, my friends, I'm glad to respond that by saying this. Your reporting, your writing, your news, your stories have directly impacted the viability and success of some of the organizations that we will discuss today, and many that we will not. Your work, your words, your photos, your stories, they matter. And let me also say this, while I am not a journalist, I would like to tell you that I was a public relations professional for 15 years. And so I like to think of PR as the first cousin to journalism. And it is with that in mind that I come to this space today, understanding that stories, the media, can impact shaping opinion, can impact shaping public opinion, driving policy, and securing funding for news outlets and the various missions of the organizations that you as journalists cover. However, when it comes to actually measuring long-term impact, I think Dr. Seuss probably put it best. Everyone is literally just waiting for a train to go or a bus to come or a plane to go or the mail to come or the rain to go or the phone to ring or the snow to snow or waiting for a yes or a no or just waiting for their hair to grow. Everyone is literally just waiting. But what are you waiting for? And so when we consider measuring impact, oftentimes as professionals and or as donors, we are considering the telos, or the Greek word meaning the end, the finish, or the purpose, or the goal. And we're trying to determine if we can achieve what we desire to be measured. But my friends, what I would like to think for us to think about when we think about measuring long-term impact, I want us to think more about moving towards completion or achieving a goal rather than really meeting that set goal. Because many of the stories that you unearth, many of the things that you cover as journalists, the struggles, the issues, the causes, they did not happen overnight. And so in measuring impact, we need to kind of keep that in mind. Measuring impact often happens in incremental steps. So next slide, please. Let's consider some causes where impact is literally measured in the long term. Many of you know medical research, for instance. Medical research is often, there is an initial impact, and then there is long-term impact. And many times the donors may or may not realize what the impact of their gift was at that particular time. And so I think as journalists, you also have to keep that in mind when measuring impact. Art is another thing, because art is very subjective. It's in the beauty is in the eye of the beholder, as they say. And so you can't necessarily always measure the impact of an art exhibit or what it means to someone. But what you can do sometimes is to measure, did you diversify your audience? Did a single ticket holder become now a member of a particular entity? And then there's also education. When you think about scholarships, and how they are awarded, you don't necessarily find out the impact of how that scholarship or that grant money really impacted the student's life until they had successfully matriculated and graduated, and or until they find a career in their specified field. And so at this time, I want you to think about some other avenues or some other causes that also don't necessarily show impact when you're thinking about measuring impact initially. Can we talk about that for a little bit? And feel free to raise your hand or just think about it. Put it in the chat.
I guess we're allowed to just speak out if that's okay. I'm having some internet trouble, so I won't put on my camera until later. But I can think of things like metrics that we use all the time, like reactions to social media posts or things like that. So they're great measures of engagement. So we know how many people maybe interacted with the thing. Did it raise their awareness? We hope so. We think that's what that means. But until we ask the question, did you know about this thing before? We won't actually know, was awareness raised versus did they engage with us?
Exactly. That is so true. You won't know until you ask the follow-up questions. And sometimes you don't have the privilege or the opportunity to ask those follow-up questions. So you have to base your metrics based off of what that initial response was, right? Yes, I think Aaliyah, I think that's how you pronounce your name, said measuring environmental impact, stories on environment. That's another thing. It's measured, you can plant trees today, right? But the impact of those trees on the environment, you won't know right away when you're thinking about measuring impact over the long term. And you might not have the benefit of finding that out. I see that Eli has his hand up.
Yeah, I'd like to second the environmental impacts. I think that's a really great example, in that it takes seeing the impact, measuring the impact over time, and a lot of impact measurement that is being done right now is in environmental sector businesses and organizations because of the ability to technically or with definitive data with quantitative data to do those measurements. But a lot of the impacts that are that we would like to track with related to journalism impact or the impact of journalism content. If you think about things like civic engagement and voting patterns, it's not as easy to show, or it's difficult to show the direct correlation, or you need time in order to show the correlation between the impact of journalism, or even the presence of journalism organization in a community, and the impact that can have on down ballot voting, for instance, or levels of civic participation, or participation in public health initiatives.
I would absolutely agree with that, Eli. There, the direct correlation is sometimes hard to navigate when you're thinking of how does journalism impact an issue, right? And I think we'll talk about this a little bit later. That is something that is something that we will really have to hard press with donors to get them to understand. And so this, as we continue with this dialogue, I hope that you'll see through the examples that I'll share how journalism can impact and has impacted measuring that there's been a correlation between journalism and measuring long-term impact with some of the organizations that I'll talk about in a few minutes. But it is true, long-term impact versus short-term impact, direct correlation is sometimes hard to come by. And so what can we do about that, I think, is what we'll kind of try to unearth here today as we talk and dialogue together. Next slide, please. So just as we discussed, some of the challenges when considering measuring long-term impact is that donors want to see impact right away. And a lot of this has to do with impact-based fundraising, where the strategy is connected to fundraising dollars so that the donor can see the impact that they are creating. And it relates to how donors want to relate their dollars to understanding how they can make a difference in the world. And in that way, that impact fundraising, but also impact investing, where companies or firms provide funds to improve the environment or society, but they get a return on the investment. Sometimes what gets lost in the dialogue is the mission. And I think that's the one thing that as journalists and as persons who are seeking to have your outlets funded, you have to think about the dynamic in the power shift, or the dynamic in power shift, so that the mission of your organization does not get lost in the donor's desires. And mission drift is a real thing. And it can happen even in a media outlet, right? And so I think that's something that has to be kept in mind. And then we also have to think about how impact will differ from organization to organization, regardless of the size. Because again, you need to define what the specific goal is that you're trying, what it is that you're specifically trying to measure, whether that's policy change or hearing diverse voices, say, in the media, or whatever that would be. Your impact will differ from entity to entity. And so how you measure that will also differ. And audiences may vary as well. So when you're thinking about how you relay impact information, how you relay data is going to differ according to the audience. I know we try to have a broad stroke in that, but that's not always possible. And it's not always the right thing to do. And so you have to think about that, but then also think about when you're collecting the data, what data matters, and then how do you share your data across your different departments and your journalistic entities, and so that you can avoid silos. Because I can tell you, even outside independent of a journalist, like a media outlet, even in other nonprofits, other serving nonprofits, information silos are real. Data silos are really real, and they can impede progress if information is not shared, data is not shared across the various departments. So whether it's quantitative, and you want to mix a mix of quantitative and qualitative data, but it needs to be shared across your various units and departments. And I think sometimes this gets lost, right? So maybe just the program people want to know the data, but the publisher might need to know the data as well. So I think you just need to think about how data is shared and the type of data that is shared, because this can present a challenge even when you're trying to share it outwardly to your external audiences. And so I think it's necessary to just think that through a little bit more. And then also, one of the challenges that I think sometimes we face is that what is the motive behind collecting the data? Will the data matter? And how will the data impact the entity internally as well as externally? Because again, every audience might need the data given to them in a different way, and its capacity to influence or drive something else is very dependent upon how the information is shared, but also what is shared and the audience to whom it is shared with, right? So I think that's something that needs to be considered when you're thinking about the challenges related to measuring things over the long haul. Next slide, please. So this leads me to thinking about when we're considering measuring long-term data, I think we need to ultimately remember people, and that measuring data over the long haul really has to be, I think, from my perspective, a little bit more people or relationship centered, as opposed to really just focused on the donor. And the reason I'm saying this is because you're looking to address a cause or to move an issue forward. And so, for instance, when I worked at Black Doctors, the rationale or the why was that people of color were dying at a higher rate from the COVID virus. And the people who were impacted were the BIPOC communities themselves, but also medical institutions, families, morgues, and everyone in between. And what we used to indicate whether we were driving impact forward was the number of people being tested and vaccinated. And then we also used patient surveys. And these are things that I know that even in journalism, we talked about this, that some of the drivers or the indicators that you use are surveys or trying to correlate direct impact of a story to how policy changes have moved ahead, right? And I think it's just important to think about how media and journalism can drive impact. And I think I just want to spend a little bit of time like thinking about those opportunities, thinking about it through an opportunities lens. So one of the spaces and places that I worked, of course, was the Black Doctors. And I think this is just a really good indicator of how journalism and the media really played into supporting a cause and issue. So during COVID, Black Doctors became a media darling because leadership really used its relationship and or created a relationship with the media in a way that allowed organization to really secure funding, but also to drive home the necessity of being tested and then eventually being vaccinated. And so it is a fact that by February of 2022, there were approximately 1,000 media impressions specific to the Black Doctors Consortium and or the leader, Dr. Stanford herself. And the organizations were across the board. The media entities that we interfaced with were across the board. There was the Philly Inquirer, the Philly Tribune, 6ABC, CBS 3, NBC 10, Fox 29, Good Morning America, CNN, MSNBC, Facebook even named Dr. Stanford as one of the, during Women's History Month, as one of the women changing the world. She was one of, I think, 7 women worldwide that got this recognition on Facebook, because they did like a story, if you will, on Facebook of all of these various women who were changing the world during the time of COVID. There was also Instagram and Bloomberg News, just to name a few. And what happened was, Black Doctors, while it started off as a grassroots entity, because the power of using the media and journalism, we were able to grow into a national model for healthcare delivery systems. And so we went from people being tested in gyms in 2020 to almost about 18 months later, opening up a full health equity center. And a lot of this had to do with the power of the media, and the media really reported on everything that Black doctors was doing, to the point where the White House even reached out and the US Surgeon General came. It really became a media sensation because of the work that we were doing, but also we were able to leverage the work that we were doing and have the media to support us in sharing the news. And so funding was not an issue really. And we really received a great deal of funding because we were always in the media. And the media was such a partner with us in driving information forward, in terms of letting everyone know where we were going to be to vaccinate or to test. And we used it to our advantage to not only secure funding, but to inform the public. So even when the vaccines became available, the staff, including the doctor herself, were vaccinated, and the news cameras came because people were afraid, particularly, communities of color, because of the longstanding history of testing and using communities of color in testing in the US history's medical system. Think Tuskegee, the Tuskegee experiment, if you will. But to curb that, the fear that was in some ways out there in the general public, the doctors and the staff were vaccinated and the vaccines were done, and it was publicized, and so many media outlets came to watch the doctor herself be vaccinated on camera live, and it was shared. And this really, in many ways, gave not only credence to what the entity itself was doing, but it also helped to, if you will, relegate the fear that people had regarding being vaccinated. And people came in and literally said that. That because they saw the doctors being vaccinated, because they saw her getting vaccinated, they were now more likely to be vaccinated. I mean, even the same thing when the boosters came about. So there was literally a direct correlation between the media stories and how it impacted our ability to fundraise, but also how it impacted our ability to inform the public and to keep the public informed, because at the same time, COVID was raging, there was also a lot of fake news and crazy ways to discuss how to prevent, the illness itself. And these things were all untrue, but because Black doctors became credible via it having a voice in the media, we were able to use the national media outlets to discuss what it really meant, what these vaccinations and this testing really meant in hopefully mitigating death and additional illnesses related to COVID and byproducts of COVID illness. So I think that was just such a dynamic opportunity where the media really helped us think about initial onset impact, but then over the longer term. Because again, COVID started in March of 2020, but by the time we opened up the Health Equity Center, it was almost 18 months later. But the media played a big part in us spreading the word about that, and therefore securing funding over the long haul. And so I think that's just one way that when you think about the ability to see how long-term impact can be measured, it was measured in the amount of media impressions that we had, and our ability to always be forward-facing help advance the mission and the cause, but also supported the capacity to secure funding. And I think that directly correlates to what it is that I think you as media outlets, when you're thinking about securing funding, you have to think about the incremental steps, right? And so I think we can move to the next slide, or we can talk about some more. If you have any questions, we can talk about, feel free to ask any questions that you might have at the moment, and then we'll continue on.
Yeah, I just want to call it a question in the chat from Kim at the Cal Poly Journalism. Did you have a baseline number for a comparison, or does the number of people vaccinated demonstrate impact clearly enough on its own?
So I can tell you this, with regard to the Black doctors' capacity to vaccinate. At the time of vaccination, when vaccines actually testing started, BIPOC communities here in Philadelphia were not being tested at the same rate as other communities here in Philadelphia. You can look this up at the City of Philadelphia's health department, because they actually have data related to this. And literally, because we were able to be forward-facing in the media, the Black Doctors Consortium had hosted a vaccine event. I want to say it was in February of 2021. And we vaccinated 4,000 people in 24 hours, and the news media covered it all day. And it was in the middle of a snowstorm, a snow and ice storm, and people waited in line for 24 hours. People really were in line 10, 12, 15, 8 hours just to be vaccinated. And literally the media was there with us all throughout the day, interviewing Dr. Stanford and just being on site inside I believe it was at the Temple Leah Core Center that day. And we vaccinated about 4,000 people in a 24-hour window. And that literally had to do with our capacity to be forward facing in the media, right? And so that was a short-term impact, but 24 hours in the snow is a long-term impact when you think about how people were able to secure being vaccinated when months before they did not have access. And so I think that's something to be said about the media's support in that space. Any additional questions?
We'll have plenty of time at the end also. So
Okay.
if stuff comes up, yeah, please feel free
Okay,
to.
so we can move along. Well, to the next slide, please. And then, I mean, these are just some other things I want us to think about when we're thinking about long-term impact. March of Dimes is a good space and place to think about long-term impact. Initially, as many of you may know, March of Dimes was initially established to think about curing children who were, I'm just looking at some of the responses, who were suffering from polio, right? Eventually, polio was eradicated, and over a course of time, polio was eradicated, but it was still covered because President, I believe, Roosevelt initially established, if I'm not mistaken, and I'm looking through my notes here, the March of Dimes, right? President Roosevelt established the National Foundation for Infantile Paralysis to combat polio. Eventually, when polio was basically eradicated, the entity itself, it still had a mission and a move behind it. And so what had to happen was it was still funding there. There were still people who were interested, right? There were still stories about this in the media, but the entity itself had to change its focus. And now, as we know, March of Dimes now, it attends to maternal and prenatal health care, right, and infant mortality rates. And so I think when you're thinking about measuring long-term impact, even from the media perspective, sometimes the shift will change because something will change, a policy will change, something will happen, and you will have to establish how then do you continue to move forward, right? And this will get us to the strategy that I want us to talk about, and the thing that I really want to leave you with when we're thinking about measuring long-term impact. So next slide, please. So this is the main thing that if you get nothing else from anything else that I've said today, I want to leave you with this. This is something that I like to call the real strategy, or the real strategy model when it comes to considering long-term impact or measuring long-term impact. As a news outlet, as a nonprofit seeking funding to support your efforts, you have to be real and realistic with your funders. And you have to let your funders know that the result that was anticipated may not come to fruition, but you still are serving people, right? And so you can ask for an extension to modify the performance indicators as they may be wrong for the project or the audience, or ask if the funding that they have already given can be used to fund some other aspect of your mission. And I know this sounds not doable, but it is in fact doable. So for instance, even as journalists, right, you have a mission and your entities have a mission. But if what you are measuring, the performance indicator does not make sense, you might need to modify that. And I have a good example of that. When I worked at BDC, we had a funder who wanted us to to measure or have determined the number of daycare providers that we could get tested, right? That's what they wanted to fund. But during the pandemic, eventually all the daycare centers, most daycare centers closed because people were working from home. And so people were their own daycare center. And so we had to go back to the funder and say, what the desired thing that you are seeking to have impact upon, we will not be able to measure that because the daycare centers themselves have closed down. And so now we need to come to some agreeable understanding of what else can these funds be used. How can we reimagine your support? Because the thing that you want to be measured literally cannot be measured. The audience, the intended persons that you want to impact and benefit, they are not there. They are not going to work because their jobs have closed down. And so ultimately the funder let us extend our, they still wanted us to measure daycare centers, but over a longer period of time. And then they allowed us to test not only the workers, but also families and children. And so together we reimagined what their funds would do, but we had to have that hard conversation up front. And then this gets to the next thing in the real strategy. Be upfront with the funder and establish that trust and let them know that what they are likely trying to measure over the long term, they may not realize it right away. And that the near-term results are still good results and they still matter. And so you have to establish that dialogue and that sense of trust right up front. Then secondly, I think in this model, a thing to think about is to have a strategy to fund the project or the impact that you're seeking up front. Because here's the thing, if the funder chooses, if you, for whatever reason, can't, that impact can't be measured until a longer term, and the funder is insistent that it happens now, perhaps that funder is not the right funder. So that means you need to have a strategy in place to get your projects and programs funded. And a lot of times, and because I specialize specifically in grant writing, I tell people you need to have a tiered or a dynamic fundraising strategy that looks beyond just grants, but also looks at sponsorship opportunities or annual appeals or events. However you do this, you need to have a mixed funding strategy because your assets, they matter, but you have to think about how that impacts your capacity to live out your mission. Finally, I think the thing you need to do also when we're thinking about the real strategy for measuring impact over the long term is, again, have a mixed funding strategy, but ask the funder up front, will they just make an initial investment and think about the incremental progress, right? And then also think how they can still give a gift at a later date as progress is seen over the long haul. So say you can measure something over the course of 6 months to a year, but say in the 9th month, you can go back to that funder and ask them, will they consider leveraging their initial investment so that they're protecting protecting their initial investment by extending their initial investment and considering how over time those incremental progress steps will really become the measurable long-term goal or the thing it is that you're trying to achieve at the end. And I just think that's just something to consider when you're thinking about measuring over the long term. I think the best way that I can probably think about measuring long-term impact is simply this. And I heard this quote: sometimes you will be required to plant shade trees under which you will never sit. Donors have to understand that just because a project or the metrics are not completed in their lifetime, it does not mean that the work or the mission of your entity or the outcomes, your initial outcomes, aren't good. Much of the good work of long-term measuring impact over the long term, it happens incrementally. It is incremental. And so you have to think about incremental progress. And I leave you with this: the good stuff of long-term impact is measured by the growth of a seed. So keep being journalists who plant seeds, who plant stories, because the DNA of a tree is still found in the incremental development of a seed. And at that, I thank you.
I love that analogy. That was really, really wonderful and such a great takeaway to frame this whole conversation. Thank you. So if folks have questions, feel free to drop them in the chat, or feel free to raise your hand and come off mute or turn your camera off. I'm happy to start also. I love the real analogy. Going back to the R and having those difficult conversations with donors, how do you start to bring that up and begin those conversations with funders? It seems like those can be really difficult conversations to have. And then Stephen, we'll go to you next after this.
So I think we can see, like inside the organization, we can see when things aren't going the way we had anticipated, right? And I think as entities, as nonprofits, we have to kind of shift the power dynamic and understand that while the donor wants to give to the cause, we still have a cause to address. And so if I can't meet those metrics, it is literally wise to have the conversation, because it really establishes that trust up front. And you can say, I know this is the thing that we thought, we were hopeful, we were optimistic that we were going to be able to measure, or this was the goal that we were trying to achieve. But as it turns out, that is not going to happen. It is, and these are the reasons why. And I think you have to be able to not be afraid to say that, because oftentimes a funder will be a thought partner with you to reevaluate what then is it that we can measure that is success, that is successful about this project. And I have a good example of that. I work with a nonprofit. I sit on their board, so to speak, and provide strategy and thought with them. And we were having a discussion around camp. And camp was a beginning in about 8 weeks, but there were some challenges and some gaps in programming that we couldn't figure out, and logistics that we couldn't figure out. So what we did was we had a charrette. And for those of you who don't know a charrette, it's basically a convening where that's usually thought about in architectural design, right? So when you're planning, like planning a building or some major project that deals with a city planning or something to that effect. But it's a convening nonetheless. And what we did was we brought the donors, other community partners, and the students who were going to be camp participants to this convening. And we said, here are our challenges, right? Collectively, let's think about how to resolve these issues. And lo and behold, the students who were the direct beneficiary of the camp itself, right? The reason we exist, came up with the resolutions as how to address some of the logistical challenges, but also some of the programmatic challenges. And what resulted in that was the funders were in the room, the funders heard the students' resolutions to the challenges, and the funders added additional funding on top of what they were already pledging and giving, because the audience who benefited was in the room and they had voice in the resolution. And so I say that it is possible, but you have to be willing to take the risk, right? You cannot be risk adverse, because if you're risk adverse, then your cause will never be addressed in a way that really benefits the community that you're seeking to serve. Next question, Stephen, I think.
Hi there, can you hear me? I was just messing with my mic.
Yes.
So I definitely learned a lot from this. Thank you. I did have a question about how some of these things might translate more directly to journalists trying to measure our impact for funders, because you were giving examples about nonprofits and the type of work that they were doing in the health field, and you were talking about counting media impressions as part of that impact.
Mm-hmm.
But if you are media, beyond counting our own media impressions or major things like winning awards or policy changes that are citing us, do you have suggestions on things we could be measuring for our journalistic impact?
I mean, I think some of it has to do with, I mean, things as simplistic as, well, like in the media, did someone else mention your story, right? Because oftentimes, in the media, journalists will mention that they heard on another program, or that in another story byline, this information was covered that was shared by another outlet. And so I think measuring those types of things are direct correlations, right? And so I know that you are measuring, from my perspective, because again, not a journalist, just a PR person for about 15 years, you can measure those said things. Like, did someone say in another report, oh, this came from this, or our partner, another outlet said this, or also the public speaks too, right? I heard it or I saw on. So those are ways to measure how that impact, how you are having impact and how your stories drive change, if you will, or drive conversation even. Yes, other hands. Naima, I think I'm saying your name right, correct?
Nahima, but
Nahima, yes.
They're related. So one, I want to say thank you for the speak. I have a question, but just to talk, Stephen, you had mentioned about, as journalists, how do you measure it? I'm an epidemiologist, not a journalist, but I work with journalists, and we specifically look at science activation and science accessibility. And a couple of ways that we've done it is, so like, if we had one example is we were interested in brain donation, right? Getting people we partnered with scientists who are doing brain donation research and needed people to actually sign up for brain donations. We did a Zoom call, and the way we measured it was, we talked about the issue, we had our event on Zoom, and then our partners gave us information with their baseline on how many they get per week usually, and after our airing of the show, of the segment, how many people did they get to sign up for the actual brain donation. So that was one way that we kind of did impact measurement. Another way that we've actually used a lot of is, if you do Zooms, and not everybody does Zoom, another really great tool is Zoom polls. So we'll ask a question. Example is, we talked about anesthesiology, right? Like anesthesia, what does it mean to go under? People have fears. At the end of the Zoom call, we asked our audiences with just one poll question, before and after the Zoom call, did your knowledge and comfort level around anesthesia stay the same or increase or get worse? And that one question we were actually able to show just at the end of the Zoom call, with that one poll questions that we did make a change in knowledge and we made a change in the comfort level around anesthesiology. So there are a couple of ways that we've done that. So just, I don't know if that's helpful or not. But my question for you, Karol, was a lot of the things that I've been seeing a lot of, not just in the media space, my background is mostly in public health, is the use of theory of changes. So I'm not sure if you have a lot of experience with what a theory of change is, how it kind of has been implemented, but it's something that we're working on internally to kind of think of what is it that we want to change in folks? What is it that we have realistically, our resources and the outputs that we have, the content that we have, can we make those changes? You know, impact can be huge. How do we like kind of hone down on the things that we actually think we can make changes on? That's what we use as kind of a measure. So for example, we're really interested in discourse and information seeking behaviors and knowledge sharing. So we'll ask questions around those either in surveys or interviews or events that we'll do. But have you used the theory of change in your practice when you talk about impact, or can you talk a little bit more about that?
Yeah, so for theory of change, just thinking about what it is that you're trying to impact and what resources. And so I think that kind of gets back to the real strategy I was talking about in a way, because you really do have to think about the assets that you have internally and the thing that you're trying to impact. And if you don't have enough assets to impact, say something on a grand scale, what is it that you can impact that is meaningful, right? Because sometimes the things that your entity wants to impact is not the thing that the community is interested in. And I think somebody talked about, I think Aaliyah said something about community-centric fundraising and thinking it's like a combination of community-centric when you're thinking about what matters to the people, as well as what can we do to help change or drive something forward with the assets that we have, and how can we realistically do that, right? And I think that is a question that really requires some thought. And I think people have to kind of sit in that. And I think even as the news media, as journalists, but across the board, even as nonprofits in general, sometimes we get caught up in the thought that if we make it, or if we say it, or if we print it, they will buy it or they will believe it, right? But did you ask them, right? Did you ask? And sometimes ask the question before you build the ship. Because everybody's not necessarily interested on getting on board. And I really think that has to deal with that theory of change, but also that community-centric approach when you're thinking about measuring metrics. What it is that you're desiring to have an impact on might not be the thing that really is beneficial to the community, because a lot of times you have to think about the power dynamic in that. And that's a real thing. Power dynamics is a real thing. And that gets back to Joseph, when you asked about how do you have those conversations? You start by reaching out and saying, this is where we find ourselves today. Realistically, theory of change, right? These are our assets. This is all we can literally measure. Our staff is not that big, but we have a great tool, and this is the things that we can measure, and this is the impact we believe it will have to have this social outcome, right? But you have to be willing to take the risk, right? So I hope that helped a little bit. Thanks.
We have time for maybe one more question. Any last questions, thoughts, comments? Well, this was excellent. Please interrupt me if there are any last questions. Karol, thank you. This was wonderful. Thank you so much for sharing your insight and expertise. Thank you, everyone, for your great questions and a really thoughtful and insightful discussion. We'll share back the recording and the slides, and I'll also share links to all the resources that everyone was posting in the chat that were really excellent. And yeah, please feel free to reach out if you have any questions or additional feedback or anything else you'd like to see next from us at the New Philanthropy Network. We're really here to be of service to you and support your fundraising work. So if there's anything else you'd like to see from the network, please let us know, and we can do our best.
Oh yeah, I'm going to share my email. I see people asking for it, so I'll share it.
Yes, and we'll include that in the note as well. So
thank you so much, everybody. It was a pleasure.
Thank you, everyone, and have a great rest of your afternoon. Thanks so much.
Thank you, Karol.
Thank you.